Hi, Dr. James Bullock at Orthopaedic Center, South Florida, sports medicine and shoulder surgery specialist. I'd like to talk to you today about Achilles tendon ruptures. Everyone who's watched sports, especially basketball and even recently in the playoffs in football, has probably seen an athlete who has gone down because of an Achilles rupture. In my office, I often see as well recreational athletes who are playing basketball or flag football, and they're running down the field or court, and they felt as if someone hit them in the back of their leg, or in some situations they feel almost like they got shot, or they hear a loud pop and they're wondering what's going on, but they fall to the ground. And what's happened in those situations is an Achilles tendon rupture. Especially in basketball, for example, when patients are changing direction, but the foot is planted and they're about to put the heel down, but they're pushing off at the same time. What happens is there's an opposing force on the Achilles tendon, which is a tendon that connects the calf muscles at the back of the leg called the gastrocnemius and the soleus muscles to the heel bone or the calcaneus. And that force where the tendon is being lengthened because the heel is going down, but they're trying to push at the same time and the muscle is contracting, will create opposing forces. And sometimes if the tendon has been weakened from chronic tendonitis, for example, it's more susceptible to rupture. In those situations, then the patient ends up in our office and we have a discussion with them about the options as to whether we pursue a functional rehab program, which can also have good outcomes, or surgical repair. And especially in high-level athletes, the surgical repair is attractive because we're able to get end-to-end opposition or contact of the tendon, and it doesn't heal in a lengthened position. But I do discuss the non-operative and operative options with patients. And on the operative side, there are some newer techniques available. So instead of requiring a lengthy incision, we do what's called a percutaneous repair, where we have a very small incision just around the injury zone. You don't have to make an incision along the entire length of the Achilles tendon. And so the recovery is a lot easier and there's less concerns about wound healing issues. And with the right rehab program, it makes the rehab easier. Ultimately, it still does require some time to allow the tendon to heal, and then to gradually increase the activities, jogging to running, and ultimately bounding plyometric type exercises, because we have to retrain the tendon after it's healed to know how not just to tolerate forces on it, but also how to tolerate the forces at a rapid rate, which are required for jumping and explosive sports. But patients can have excellent outcomes with this surgical repair, and now with less invasive surgical techniques.